Thank you so much. In the back, we have Kara. Kara is our workforce development coordinator. So Kara does all things scholarship for Mcleod Health and getting those things paid, and also upskilling our current workforce, our current staff, upskilling them into careers that they want to go to. And then I have with me Tim Collins. Tim will be speaking with you shortly. Tim is the director of IT Acute Clinicals, right? And then I have Shelly Massimillo. Shelly is our associate vice president of IT Acute Clinicals as well. So they will be presenting shortly. They're here for questions that I cannot answer for you guys because they know all things IT. And if you ask me a question about IT, I would have no idea how to answer it. So that's why I brought the specialists here so that they can answer all of your questions. Well, with that being said, we'll get right into it.
Yeah, I got the pointer.
Oh, you got the pointer?
Unless you want me to.
That's fine. If you want to do it, that's fine. So yep, I am Rebecca Chilton. I'm the Workforce Development Allied Health Student Coordinator. So I coordinate all non-nursing fields in healthcare. I do everything from internships to shadows, and then clinical capstone projects, things like that. So everything that's not paid, but you still are required to do it for school credit, or to apply to get into maybe a doctoral program or something like that. And then of course, Tim is on there as well, and he will be speaking with you shortly. Okay. Did it go over? There you go. Yep. So this is our mission. So the mission of Mcleod Health is to improve the overall health and well-being of people living within South Carolina and Eastern North Carolina by providing excellence in healthcare. And our vision is to be the region's choice for medical excellence. So as for Mcleod Health, you saw our map up there earlier, and I'll have another picture as well. We currently have 7 hospitals, ranging from Mcleod Health in Florence to 3 locations at the beach, Sherrall, if anybody knows where Sherrall and Pageland is, and Dillon, and Clarendon, which is in Manning, the Sumter area. So we cover the PD and coastal regions of South Carolina, and we have already started branching over into North Carolina, such as Sunset Beach, North Carolina, and other places along the coastal region as well. Our values, we have the value of caring, the value of the person, the value of quality, and the value of integrity. And so anybody that comes to Mcleod Health working as our employees, these are our core values. We truly care about our patients, our employees, who we serve in the community, because one day, that's going to be my family member in the hospital, or it could be your family member in the hospital. And we want to make sure that our community and our employees are taken care of and are caring for our patients as a whole. I want to save time for Tim to do some questions and answers and things. So these are the communities that we serve, like the map that was shown earlier. So these are all of our hospitals. In the little red pluses, we have approximately 200 doctor's offices within this area as well, and over 18,000 employees. That's contract and actual full-time employees, PRNs, and all employees of Mcleod Health. The largest location is Florence. So Mcleod Regional Medical Center in Florence is our largest. It's a 516-bed hospital. It's a trauma level 2 center. And we have all services, like mentioned before, from cancer center, pediatrics, NICU, ER and trauma services, surgical services, robotics, heart and vascular, labor and delivery, all the things that is made up of a hospital. We've been in service for 119 years. Our hospital system was started in Florence by Dr. Mcleod back in 1906. And it was started because there was not a hospital in our region, and it is grown to what it is today. Let's see, and we have served over 1 million people. So all of this is just some highlights. This is probably a little bit older than the information that that our gentleman put up there earlier, but that's just a quick highlight. So now I'm going to introduce you guys to Tim Collins, and he's going to do a quick overview and of our IT area. So thank you guys so much for having me.
All right, so good morning. Jake, you mind presenting for me? I mean, you did a good job, so I don't mind switching with you and you can just go over my slides for me. But good morning, everyone. My name is Tim Collins. I'm excited to get the opportunity to talk to you all about healthcare IT. Just to give you all some background information, I went to USC for both undergrad and graduate school. So I am definitely committed to the cause here in Columbia, South Carolina. In fact, I'm so committed that my wife is a research professor here in the psychology department at the University of South Carolina. My oldest son, he is a senior this year, and so he will be graduating this December here at USC. And my two kids, my two youngest kids, they both go to the daycare here at USC. So I am a Gamecock for life. So definitely here, you know, and I was a student. I sat here in these same seats that you all are sitting in. And so I definitely want to get the chance to talk to you all about what healthcare looks like from an IT standpoint. But before I get started, quick question. Did anybody in here or have anybody in here been to Bernie's Fried Chicken by the stadium?
All I've heard.
Yes, that's what I wanted. So I'm going there after finish presenting. I'm taking Shelly with me, and so she's never been, but it is a great place. And if for those who haven't been, definitely you all should consider that before you graduate. It is a great place to go to, and it has some of the best fried chicken in South Carolina. All right, so enough about food. So I've been at, I've been in healthcare for about 17 years. I've been at Mcleod for about 7 years. So in fact, after Thanksgiving, I'll be right at my 7-year mark at Mcleod. But I've been in healthcare for a while. So I've worked in practice management, I've worked in quality, I've worked in reporting. I've also worked as a trainer and educator for a lot of our clinical staff. And so now I'm on the application side. So with that said, there's a lot of opportunities within healthcare, and some of you all are here and you know exactly what sector of IT you want to go into. You know where you want to go, you know where you want to move to, and you know what type of role you want to be in. But some of you don't, and that's perfectly fine. You all still have time. And one thing about information technology, it is growing exponentially. So jobs are coming. The whole AI move is something big, and new careers are going to be created from that. And so definitely, you know, use times like this to learn as much as you can and really, you know, connect and ask questions. All right, so okay, it's already on the slide. So, all right, so high level healthcare IT is broken into 3 categories. So you have a leadership role. And those are, you know, the people that manage the IT teams, and what they do is they provide guidance to the analysts and to the support staff that aligns with our mission and vision. And so that's one category of IT. The next one is clinical. And so those are your people. Some people come from clinical backgrounds, and we are seeing a big movement of a lot of clinical staff who are interested in IT. And they also take IT related jobs because they want to help close the gap between IT and medicine, because there's a difference of how a computer looks versus a human body. So having those people in those roles is now, you know, a very crucial thing in a department. And then you have your technical standpoint. So that is your infrastructure, your the people who work with all the technical components within the hospital to keep the hospital running. All right, so if we dive a little deeper, you can see that some of these jobs can be sorted into 4 roles. So system and infrastructure, once again, that is your backbone, right? So that is all of your network folks, your help desk folks, your server guys, you know, cybersecurity, which is another growing and big field. Some of you all may have some interest in it. But that is your system and infrastructure. You know, they're really behind the scenes, and they do a lot of work with maintaining the technical infrastructure here at Mcleod. And then there's informatics. So 20 years ago, if you would ask what informatics is, no one would have no idea what it was and what does it do. Some people were already working in that role, but it wasn't really defined. And so now informatics itself is a very growing and diverse field. And you can look at informatics in 2 ways. One, the clinical side of it. And what clinical informatics is you actually have clinical staff, and Shelley has some experience with being in clinical informatics, but this the clinical staff, and what they do is they look at workflows and see how can you improve those workflows through the use of technology. But then you also have a data side of informatics, and that is they're pulling data from the system and using that to improve and to define any type of quality initiatives within healthcare. So, and there's probably more stuff within the informatics realm on our team. We are also big in informatics because we are more of the application support and the application development, but we also have a bunch of clinical folks on our team that also serve in some informatics capacity on our team. So going to application support, these are the people who support a particular application or department within a hospital. So think of your doctors, think of your nursing staff, think of your department like the emergency room, think of respiratory therapy. So you have these group of IT support staff that supports that department. And what they do is they help build and maintain. They may coordinate any type of downtime and upgrades. They also build into the system, which is called an electronic health record. I'm going to talk about that shortly, but they support the application that they are overseeing. And then application development. These two, support and development, once again, you can kind of put them two together because the development side of it is, if you think of some of our programming folks, our people who do coding, and they work within the application itself to build and optimize it in a way that we can use it. All right, so these are some of our technology applications we have here at Mcleod. And as you can see, Epic is to the left, and that is our electronic health record. We have Oracle, and we use Oracle for a lot of our HR related things. We have ServiceNow, so that is our ticketing system for issue resolution. So from an IT standpoint, we get tickets from end users that will put in a request saying, hey, my printer is broken. And so that ticket goes to a specific team, which is that application team, going back to application support, and then they would then work to resolve that issue. So we use ServiceNow. We also use Microsoft, and Microsoft is our business management software. Everyone in here should be familiar with how Microsoft works. And then we have Merge. So Merge is our cardiology and radiology imaging software. And so we have a team, and it's actually under our department that really does all of the imaging, and a lot of the cardiology and radiology workflows kind of flow into that system. And then we have Harmony. And so being in the healthcare system, you have so many, over the years, you go through different systems and different technologies where if it contains patient information and you end up retiring that system, you have to archive it from a regulatory standpoint, because with patient information, you have to be able to have access to that for at least 10 years. So we use Harmony as our data archiving solution, and all of our old electronic medical records, we like ECW, Cerner, all of those, we extract that information from those applications and put it into Harmony, just in case if we have to reference it from a later time. All right, so Epic. And Epic is our electronic medical record. So Show of hands. Anybody know what an EMR or EHR is? Some people. So what that is, for those who don't know, so an electronic health record or an EMR, those are two words and they do mean different things, but overall, a lot of people use it. But what it is it's a patient's medical history that is maintained electronically by a healthcare organization or by clinicians. And so that information can be your demographics, so your address, where you live. It can also be your medical information, like your allergies, your immunizations, your vital signs, your visits. And it also, healthcare has shifted a little bit where it now contain, medical billing information and insurance information. And so that is what an electronic medical record is. And so from the Mcleod standpoint, Epic touch all these areas. If you look at the green boxes, Epic touch all of those areas. From a patient experience standpoint, patients have access to their medical chart. They can use my chart and look and see, okay, I have a visit tomorrow, or they can look at their past visit and see the information, what the doctor wrote, their after visit summary. They can also request prescriptions, or they can look to see that, hey, I want to meet with a user physician, Dr. Patel. And they can request to speak to his care team or to request an appointment for that. So the patient actually get to experience the electronic medical record. From a clinician experience, being that Epic is an integrated system, the providers can see everything regarding the patient to then make a medical decision-making assessment on the patient. They can see information with their vitals. They can see information with their lab works. They can see head to toe assessments. They can see pretty much everything for them to do their job. And then you have care coordination. So interoperability, integration. One thing that Epic provides us is that when patients come in and they are coming in from the doctor's office, and if they get hospitalized, we can see their information because it's an integrated system. If the patient shows up in the ED and then they get admitted into the hospital and then they go to radiology, Epic gives us all of those tools based on patient flow that allow us to coordinate the care needed for that patient as it hits different departments within the hospital. Revenue integrity. So being that I mentioned earlier, because Epic provides medical billing information and also insurance information, a hospital although we are focused on the patient and we have a patient-centered approach, we're also a business. So we can maximize on our revenue by using Epic to be able to process claims and allow patients to make their payments. And then research experience. So the other thing Epic, what you can do is you can pull information from Epic. You can use that for quality initiatives, workflow improvement initiatives. You also, as a healthcare organization, we're required to send a lot of information, a lot of data to, government agencies and other third-party companies because, we have to have that information available to be able to then send. And then if you look in the pink boxes, these are all the departments that Epic touch. So case management, to security, to pharmacy, to imaging, to nursing, to physicians, to lab. We have an IT team dedicated for each of these areas and we support them. And so all of that is done through our Epic EMR software. All right, so interfaces. So being integrated and Epic having a very robust and integrated nature, we have to have interfaces in place. And all of these different connections, we have information coming into Epic, we have information coming out of Epic. And so some of the three main interfaces that we have are HL7, ADT, and VITE. And so if you look, you can see that Epic is in the center. And I'm going to use SureScripts. So SureScripts is a pharmacy software. What happens is when you go see a physician and they are ordering a medication for you, they're going to place a order for a Tylenol to send to CVS or to Walgreens. And so when they place that information in Epic, that interface, and it's going through this thing called interconnect, it's going to then hit SureScripts, and SureScripts is then going to send it to the pharmacy. And that way, from a patient standpoint, when you go to CVS and you said, hey, yes, I'm here to pick up my medication, you didn't have to wait for the doctor to call. You didn't have to wait for the doctor to print out a prescription and hand it to you. It goes automatically through an interface. And so that's just a high level overview of all the interfaces that we have here at Mcleod that touches our electronic medical record. So let's talk about our setup. So once again, there's a lot of roles within IT. There's a lot of departments within IT. So I'm going to show you all what our department looks like and how our hierarchy is set up. So we have Shelly Massavella, who is our AVP, and her one-up is Matt Rich, who is our CIO. But then under her, well, let me stop. We support everything from a hospital standpoint. So we have teams that support the physician practices. Our team, from a clinical standpoint, support everything hospital-based. So we have two directors. I'm one of them. I'm more of the inpatient support. And then we also have Eddie, who supports a lot of our ORs, our lab, our radiology. So anything ancillary goes to the other team. And then anything that's considered inpatient, which is the hospital, my team supports. And as you can see, we have a bunch of analysts, and each of these analysts, their application support analysts for different areas within our team and for different areas within the hospital itself. All right, so healthcare IT jobs. So what are the type of jobs in healthcare IT? There's leadership, like I mentioned earlier. You can be a manager, you can be a director, you can be associate vice president, which that's what Shelly is. You can be a vice president, or you can be a senior vice president. So that's kind of the leadership role here at Mcleod. Like that's how we map out our leaders. But then also within IT, we have project management, and project management is another big field that's coming. It's been around for a long time, but we're really seeing the benefits of having a project manager assigned to tasks and assigned to work within an organization. So from an IT side, we have IT project managers, and they come in and we usually use them for bigger projects. So if we have a project that's integrated and it's going to touch a lot of areas, it's good for us to bring in an IT project manager because they have those skill sets to see the project from the beginning to the end and make sure that we're all aligned to meeting that goal. You have informatics and training. So when I first started at Mcleod, I came in as a clinical educator. So I was a physician educator. And what that was, you know, if we hired new doctors, if we hired any new clinical staff, my team was responsible for training those people when they first got hired. But then we also followed them after they've been onboarded to make sure that they understand when they're documenting in an electronic medical record, they have all the tools, they have all of their favorites set, they know how to navigate through the system to deliver patient care. And then you also have clinical informatics. We have that department, and that group is built with a lot of clinical staff. And what they do is they look at all the workflows and use those workflows and use the system to see how can we improve those workflows within Mcleod. You also have application and department support. So I'm gonna go through all of these. We really have 3 levels. It looks like the slide got changed a little bit, but it's fine. So we have an analyst, we have a system engineer, and we have a business intelligence developer. So from the analyst standpoint, you can range from a level 1 to a level 3, and you can be an Epic analyst, you can be a telecommunications analyst, you can be a telehealth analyst, you can be a help desk analyst, you can be a program analyst. We have our business analyst. So all of them fall into the analyst realm. One interesting thing about an Epic analyst is in order to be an analyst in Epic, you have to get certified. So anyone that we bring into our department and we want them to be an Epic analyst, we actually have to send them to Epic headquarters, which is located in Wisconsin, to get certified and get trained. Now, they do have virtual options as well, so they don't have to go there, but that is an option that we consider when we hire new staff, and whether or not we want to send them to Wisconsin or do we want to set up, but you have to be certified in Epic in order to build in Epic. A lot of our technical roles are in the system engineer realm. So our client server support, our network security, our interface team, all of them, their roles are system engineers. And they also have a senior level, or they can be broken up into a level 1 to a level 3. And then our business intelligence developers, that's more about reporting and data analytics people. And so they write, queries. They pull data from the electronic medical record, or they pull data from other areas, and we use that information to then make decisions for the organization. And one thing I forgot to say is a lot of these jobs have remote options. And so that's the good thing about healthcare is, after COVID, it opened up this world of you don't really have to physically be in the office to be working. You can now work from home. And so a lot of our departments, we do have remote options. And some advice to you all is, when you're interviewing and you're out there searching for jobs, that's a question that you can ask is, do you all offer any remote options? And that's in any job, not just healthcare. All right, so there are a lot of skills you need to have when you're working in the information technology field. And, one, you have to have at least a basic understanding of IT, right? You at least got to understand like what IT means, information technology. So basic understanding of IT, but also the most important job. And when we hire people, we want to see how well they can critically think through things. And so, being able to look at big picture, what's going on, why it's going on, what are the issues, who are the stakeholders, what department this impacts, not just the simple request itself, but being able to critically think through those things will allow you all to be very successful in any area, not of IT, not just healthcare. And so what I want to do is I'm going to go through just an exercise with you all, a little quiz, just to see, how we can critically think through a situation. And so, first, before we go into the actual topic we want to talk about, but look at these 3 items here. You have technology, you have process, and you have people. In what order do you think this should be in? Which one should be first, and which one should be second? Anybody want to give it a try? Yeah. Process first, then people, then technology. Okay, anybody else? Oh, all right. Okay, and people, process, and technology. All right, so y'all got it right. It is the people, it is the process, and it is the technology. And so the people are your stakeholders. They are the people who are actually going to be doing the work. They're the people who are in those departments. They're the people who are working in the nurses, the doctors, the clinicians and everything. So when you're going through and you're trying to problem solve or trying to fix, whether it's a project, it's a task, always understand who are the people, who's the person that's asking this, or who's the person that's coming to us that needs help or that have this issue. And then you look at the process. So the process itself is, if there isn't a defined process, then how can we provide a technology solution to fix it? So you always then consider the process itself and then the technology. One thing that we do in healthcare, and I'm pretty sure this applies to a lot of other areas, is we like to get technology to fix a people and process thing, when in reality, we should fix those 2 items first, and then we use the technology to then enhance the people and process. All right, so going into more of some projects. So, 10 minutes? Okay, I'll speed through this. And so what we do from a project prioritization standpoint is IT, we get all of our people to create a project charter. And with that project charter, that gets vetted through operations, that get also embedded through IT leadership. And then we will have them create a project charter where we will prioritize that work. We also then define, measure, and analyze, improve, and then we put a control in place to make sure that all of these things are occurring to be successful. So an example of a project and what Tony was showing us, very similar to some of the project capstone work that you all have done. We have an A3 project, and this maps out kind of everything that needs to occur in the project. So you can see that the stuff you were doing here also applies to the work that you all will be doing in your future. And so I also want to, talk high level about the internship and shadowing opportunities we have here at Mcleod Health. So the shadowing experience, Rebecca, please, you can help me jump in whenever you want. So the first step is, you send an email to Rebecca. You would then provide her with an interest letter, a resume, kind of that desired IT department that you want to work in, and then your schedule and availability. Once that occurs, Rebecca will work with you, and then we will get a request for a department approval, which will come to me. I'm also the IT coordinator for all of the interns here at Mcleod for IT. And then once that approval is done, step 3, she will email you the onboarding packet. And then that information below, you would need to have a background check done, immunization records. You would also have to do a PPD and TB test. And then Mcleod Health, she would then send you the Mcleod Health student forms, and then you would then work to get your badge with your headshot. Rebecca, anything you want to add? I did my best.
I have cards up here, so if you are interested, I have my business card up here for you. Also, get rid of my email address. That would be great for me. And then the paid internship. So on that side, our actual, it will be posted on our jobs website. It's the jobs.mcleodhealth.org. And they will have internships posted, and then to apply. That's internship. That was not posted. Consider mine as the non-paid ones, and then consider actual job as a paid one. So, and then this before on the paid when it's coming.
Yep. So, and so the paid internships, just like Rebecca said, we're working to get those posted around February of next year. And so you will be able to go on the website. It's going to say IT internship, and it's going to have that respective with department that it's associated with. And so we have a lot of departments within IT. So from clinical, which is where Shelly and I are, to very technical, to networking, to cybersecurity, to desktop support, to pretty much everything you can think of from an IT standpoint is also embedded here at Mcleod Health. And also the shadowing experience. So you can shadow anyone within IT. Once it goes through Rebecca, usually what I do is I'll set up a meeting with you. We can meet, we can discuss, we can kind of find out where you want to go, and you can then shadow with that person.
Are those internships any campus or just Florence campus?
So because you all are in Columbia, South Carolina, Florence ideally will be the closest place that we would have and host the internship. Now, we do have a hospital in Clarendon. It's a very small hospital, but most of our IT related internships will be in Florence. And we have several students who are currently doing internships with us. We also have students who've done internships with us and they end up getting a job, right after they graduate, or the job offer was offered to them while they were still in school. So, and that's one of the things I do want to talk to you all about. I do want to open it up for questions, but, I am a prime example, or one of my testimony is I was an intern that sat here that took an opportunity in IT and ended up, staying in that world and growing in this field within healthcare. So I got my master's in healthcare administration. There was an internship opportunity at Agape, which was a long-term care company. And then with that, they had a desktop support. So instead of it being an intern, they said, hey, you know what? Let's just bring you in as a full-time desktop support technician for this company. So I ended up getting a full-time job while I was in school. And from there, I kind of grew into my career. I worked for Mcleod Health for 10 years, and now I'm at Mcleod. And so definitely internships and being able to job shadow, that is something that I definitely encourage you all network and just meeting the people and actually seeing what the job and how that job is. Because you can easily say, I want to be a cybersecurity analyst, but until you actually sit with a cybersecurity analyst and see what they do, that helps you then make your decision. You may be like, yes, this is exactly what I see myself doing in the future, or no, I want to go to something else. And so, and we're here to help you all with that and help you all make those decisions to make sure that your future is successful. Questions? Go Gamecocks. Anybody got anything? Oh, okay.
I guess like, what are some of the projects that interns might work on? Like, I know there's a lot of different sections they might work in, but like, you know,
Yeah, so so the projects come, so it is need-based, and usually when we bring in interns here at Mcleod, IT interns, we kind of bring them in because it's a project. So we just had a telecom project earlier this year where we replaced all of our ASCOM phones to Cisco. And so we brought a intern in to help with that. And what they did was they helped configure the phones. They took the phones from the box, they configured it, they set it up, and then they worked to deploy it at the different campuses. So there's many projects that, you know, it all depends on what's going on and what that department is doing. I saw another hand. Yeah.
That means that they're open for
For internship or for the job shadow? So internships, yes, so it will, once we get it, we usually have it set for either the course of that project, or if it's something that is like they have a need that they always want to keep rotating interns with, then it'll be through the course of your graduation. I saw yes. So a typical day as an intern is one, when you first start, you would meet the team, you would meet the department, you would meet that leadership within that department. Two, you would then work with that particular manager and they will kind of give you a onboarding kind of orientation within that department, let you know exactly what you would be doing. Some of it requires for you to get computer access. So we'll work on getting you computer access where you'll be able to log into our system. And then depending on that project and what you're going to be doing, we'll also grant additional access. Like we had some programmers that came in, some students who had an interest in programming. And so we had to give them access to, I think this, the software, Python and all of that. So we grant them access to that, and they did some coding for us while they were here during that internship.
So a typical day, would they be at a computer 9 to 5, sitting there all day?
It all depends on what you're doing. So from a programming standpoint, yes, but if you get an internship with our desktop support team, they're never in the office. They are at every hospital setting up everything. So you're doing traveling, you're going to some of the 7 hospitals that we have. There can be days where you're in Myrtle Beach for the day. It can be, you know, you may have an office day where you can sit down and actually do some work, but it all depends on where you are. And then for myself and Shelly, you know, ours is usually at the desk, but we are also, because we're clinical, required to go into the hospital. So we round with physicians, we round with the other departments. Monday, we may be in labor and delivery. We may have to end up in the OR. So we may have to tell you to put on some scrubs, come in and talk with surgeons and see some operations and everything. So it all depends on the department that you choose to intern with or job shadow.
Other question? We have time for just maybe one more, if there is. Yeah. Well, thank you guys.
One more, go ahead. What percentage of your interns come in full-time?
So we had about since I've been in this role, so I've been in this role for about 2 years. We have about 3 people that actually got full-time offers with it. A lot of people come in and they want a job shadow first, and some of those job shadowing also leads into paid internships. And so some students, you know, we have a girl with us now, she lives in Florida, so I don't know if she goes to USC, but when she graduates, she's to have the opportunity to stay here at Mcleod and work in our HIM department, or she would have those skills and she now know what HIM is to then look for a job later on. And the good thing about it, like I mentioned earlier, is if she decides to stay with us, she would be working remotely.
Well, thank you, Tim.
Yep. Thank God.